Welcome to TriArc Health's MIPS training series. This video will be demonstrating CMS measure number 131, diabetes eye exam. I'll first go over the parameters for this measure and then I'll illustrate the appropriate workflow. Generally speaking, this measure pertains to patients 18 to 75 years old with a diabetes diagnosis and an eye screening for diabetic retinal disease in 2022. A diagnosis of diabetes must be documented in the Diagnosis and CPT code module. You have two options when it comes to getting patients to numerate for this measure. The first is patients between the ages of 18 to 75 with diabetes and an active diagnosis of retinopathy in any part of the measurement period who had a retinal or dilated eye exam by an eye care professional during the measurement period. Or, your second option, diabetics with no diagnosis of retinopathy in any part of the measurement period, but did have a retinal or dilated eye exam by an eye care professional during the measurement period or in the 12 months prior. Quick note, if your practice administers these screenings, please document this in your orders and results module per your office workflow. We'd also like to remind you of key incrementing details for measures your location wants to increment on the quality dashboard, like this one. To increment any measure using the history module, the occur date must be completed. Additionally, if exam notes are not coded with the appropriate diagnosis code and corresponding CPT code, your patients will not increment. And lastly, some of the SNOMED, LOINC, ICD-10, and CPT codes that you see on your setup might vary from what you see here in this demonstration. If you would like to use an alternate code than what is listed in your setup, please reach out to support for additional options. Now I'm going to demonstrate the workflow for this measure. Before we get started on the workflow, please remember that there are some exclusions for this measure, and we encourage you to view the corresponding quick guide for more information on those exclusions. The most common workflow for this measure is to navigate to the patient's history in the EMR. You'll see I already have my exam note open for one of my diabetic patients, and I need to document when their last dilated eye screening was. So I will navigate to their patient history. Once I'm in there, I will select their health maintenance screening or whatever you have listed for your practice for your MIPS items. For this particular measure, I need to select the diabetic eye exam, so I just double click that and it puts it into the patient chart. If I'm not a practice that performs this, I just need to document when my patient last had this diabetic eye exam. I need to enter in the occur date in which that occurred. For the purpose of today's demonstration, I'm just going to select today's date. This occur date, again, is very important because this is what will trigger the system to numerate the patient for this measure once the exam note has been coded and completed. Once that's done, you may continue the rest of your office-specific workflow. Thank you for watching. Please refer to the corresponding quick guide for more information on this measure, and please contact us for any questions.